Hello, and welcome to OakLeaf Surgical Hospital's joint venture class. My name is Gina. I'm a nurse educator here at OakLeaf. I've had the pleasure of working closely with the joint venture education team to create the video you're watching right now. The purpose of this class is to help you feel prepared for your upcoming surgery. Thank you for choosing us to guide you throughout your surgical journey. OakLeaf Surgical Hospital is a physician-owned surgical specialty hospital performing inpatient and outpatient surgeries and has been serving patients in the Chippewa Valley since 2001. Before we begin discussing preparations for surgery, let's listen to a message from one of our surgeons regarding total hip and total knee replacements.
Hi, I'm Evan Peisig, one of the joint replacement surgeons here at OakLeaf Surgical Hospital. Here's an example of a normal versus an arthritic knee. You can see on this side of the screen, we see the femur or the thigh bone, the tibia or the shin bone, and particularly the space between the bones. So I would consider this a normal looking knee joint. On the other side of the screen, this appears to be an arthritic knee. You can see all the joint space is gone. The bone is now rubbing bone on bone. You can see osteophytes on the edge of the knee, and you can also see whitening or sclerosis of the knee joint. This is an example of a knee replacement. So what you can see is this is a normal knee here. This is a replaced knee. You can see the metal, which shows up on x-rays, and a space for the plastic, which does not show up. The femoral component is typically made of metal and anchors to the femur. The tibial component is made of two parts, both metal and plastic, and anchors into the tibia. There is also a patellar component, which is typically made of plastic, which anchors into the kneecap, which is commonly used. Here's an example of a femoral component. There are multiple different companies and designs that are used, and after trimming off the bone ends, we can insert this onto the end of the femur. On the tibial side or shin bone side, this is an example of a tibial component. Again, there are multiple different designs which are used. And after prepping the tibia, we can insert this into the bone like this. On top, you can see the plastic liner is already inserted. This is an example of a patellar component. You can see this one has 3 lugs, which will anchor into the kneecap. Here's an example of a normal hip x-ray, demonstrating the femoral head and the acetabulum, and particularly the space between the two bones. This is an example of a diseased hip, and you can see the joint space is decreased, and the patient is now rubbing bone on bone. You can also see some cystic changes in the femoral head and sclerosis or whitening of the acetabulum. The other picture demonstrates a hip replacement. Mostly what you can see is the metal stem, the ball, and the metal shell. Here's more detail about the components that are typically placed in hip replacement. Starting from the top, there is an acetabular component which anchors into the bone. Inside of this, we snap in a plastic liner. On the femoral side, we anchor this with a femoral stem, and onto the femoral stem snaps a femoral head. Here's an example of an acetabular component. You can see on the back side there is this roughened surface that over the course of 2 to 3 months the body will grow onto. On the other side, you can see the plastic liner. That is where the ball will articulate. This is made of highly cross-linked polyethylene, which is found to be very durable. On the femoral side, this is an example of a femoral stem. There are multiple different designs which may be used. Most typically, we use cementless implants, which have the same ingrowth as the socket, and over time the body will grow onto that. You can see up here is the trunnion of the hip. That is where we can assemble different femoral heads to adjust for leg length and offset of the hip. So we can easily snap on different heads in surgery to adjust your leg lengths. Most often these are made of ceramic, which is found to be the most durable option in the current times.
Each one of you should have received a joint venture booklet. Most of the information discussed today is included in this booklet. We highly encourage you and your coach to follow along, taking notes or writing down questions as you participate in this class. There's a list of phone numbers available in the front and a section for taking notes in the back. You will benefit from referencing the information in this booklet as you go through this process, and may actually find it helpful to take it with you to your appointments.
Hello, I'm Dr. Stewart of Chippewa Valley Orthopedics and Sports Medicine. I'm one of the orthopedic surgeons here at OakLeaf Surgical Hospital. I want to discuss an important assessment your surgeon will be asking you to complete before and after your surgery. The assessment helps us gather information about your pain, functional status, and quality of life. It also gives us the opportunity to track your recovery and measure your improvement over time. A member of the OakLeaf Hospital Patient Outcomes team will contact you by email or phone before your surgery to complete this assessment. The assessment is a series of questions designed to measure how your hip or knee problem is affecting you. The same assessment will be performed at 3 months after surgery and about a year after surgery as well. A sample question would be, what amount of pain have you experienced going up and down stairs? The answer options would be none, mild, moderate, or severe. Remember, there are really no wrong answers to any of the questions, but it's important to provide an answer to each and every question in order for us to have a full assessment. I want to thank you in advance for taking the time to do these assessments. This information allows us to understand how our patients are benefiting from their surgery and allows us to work to ensure the best possible outcomes for you and all of our patients. If you have questions about the patient-reported outcome assessment or need help completing them, please contact our joint venture class coordinator. They'd be happy to help.
Hi, I'm JT. I'm one of the nurses up on the second floor. I'd like to start the joint venture journey with you by discussing what you can do to help prepare yourself for your upcoming surgery. A successful surgery requires that you take an active role in your preoperative and postoperative care following your surgery. You've already taken the first step by attending this class. One of the first things that should take place is scheduling an appointment with your primary care provider within 30 days of your scheduled surgery. At this appointment, they will review your health history, perform a physical exam, order blood work, and order any other tests deemed necessary to make sure you are healthy enough to have surgery and complete your recovery process successfully. If you've had any immunizations recently or plan to have any, those will need to be discussed with your primary provider as well as your surgeon, especially if it's within 2 weeks of your surgery. One of the other things reviewed at this visit is going to be your medication list and allergies. It is very helpful to take a list of your medications with you to this appointment, including prescription medications, over-the-counter medications, herbal medications, and any other vitamins or supplements you are currently taking. Some medications will need to be stopped prior to your surgery. Some examples are anti-inflammatory medications, such as Advil, Aleve, ibuprofen. Other medications that you may have to stop prior to surgery are anticoagulants, often called blood thinners. Some examples of these are aspirin, Coumadin, Plavix, Xarelto, or Eliquis. One of the OakLeaf pharmacists will go over this with you and instruct you when to stop taking certain medications. They will also discuss any blood pressure or diabetic medications you may take and give you specific instructions on how to take them before surgery. Please take note of this and take them as directed. In order to reduce the risk of infection following your total joint replacement surgery, plan on seeing your dentist at least 2 weeks prior to your surgery, including any dental work that you may need to have done. At one of your postoperative visits, your surgeon will inform you when you can return to the dentist following your surgery. Keep in mind that antibiotics may be required before returning for routine dental visits for infection prevention purposes. If there is a dental emergency during the 2 weeks before your surgery or 12 weeks after your surgery, it is important to contact your surgeon as soon as possible. Other ways to prepare for your upcoming surgery include the following: quitting or cutting back on nicotine use, eating well, exercising, and getting plenty of rest. Let's discuss these in a little more detail.
Hi, I'm Megan. I'm one of the respiratory therapists here at OakLeaf Surgical Hospital. We are here for any breathing support you might need before or after surgery. One thing we believe is so important here at OakLeaf is optimizing your healing process. One way we can encourage recovery is great lung hygiene and circulation. At our facility, we encourage our patients to be nicotine-free 30 days prior to surgery. This decreases the negative effects nicotine has on your circulation and ensures oxygen-saturated blood is reaching the surgical site post-operatively. There are several risk factors of continuing nicotine prior to surgery. Nicotine use can lead to inflamed arteries, which can cause decreased oxygenation, an increased risk of scar formation, reduced joint mobility, and even an increased risk of infection. The likelihood of a patient being readmitted to the hospital increases as much as 5 times for patients who are nicotine users. If you take any home breathing medications, make sure to bring them along so we can get them checked into our pharmacy, and then they can be available to you during your time with us. If you use a device at home, such as a CPAP or a BiPAP machine, please bring it with you for your stay. This is a great tool to have with you for after surgery to encourage lung expansion. Some of our patients need a little extra time and encouragement for their lungs to fully wake back up after surgery, so it's very common for us to recommend coughs and deep breathing. We may also have other tools we use, such as temporary supplemental oxygen or an incentive spirometer, to help you have the best recovery possible. Whatever you need, we will be here to support you along the way.
Nutrition before surgery is just as important as nutrition after surgery. Eating a well-balanced diet is essential. Incorporate protein for wound healing and include fiber to prevent constipation. Try to include items like fruits, vegetables, meats, nuts, eggs, and maybe some protein shakes in your meals. Avoid foods that contain high levels of fat, sugar, or salt. It's also important to stay hydrated by drinking plenty of water throughout each day. This is especially important to help prevent constipation after surgery. If you're diabetic or have been told you're borderline diabetic, do your best to maintain stable blood sugar control before surgery. This will play a significant role in the healing process and reduce the risk of developing a post-surgical infection. If your surgeon has recommended you lose weight or work on better control of your blood sugar, you may want to discuss this with your provider. Consider asking to meet with a dietitian to discuss options available and what might be the best approach for you.
Hi, I'm Amy, one of the physical therapists that takes care of patients here at OakLeaf Surgical Hospital. We look forward to meeting you following your total joint surgery. We are here to serve you and able to help with safety in your home, walking, use of assistive equipment, and teaching you the exercises you need to know for home. We will meet with you directly in your room, either the day of surgery or the next morning. We are hoping that the information we share with you today makes you more prepared to go home. All right, we have 3 exercises that we are going to teach you in preparation of your total joint surgery. So we're going to go through about 10 repetitions of each of those exercises today. So the first one is going to be ankle pumps. So we're going to ask you to pump your ankle up and down. And you want to try to go through as much range of motion as you possibly can. So you want to point all the way down and then bring your toes all the way up. Some people will feel a stretch in their calf. You might feel a little pulling up your leg. Those things are normal. And again, we want to do about 10 repetitions. And you can work your way up to 20 as you go through your general total joint recovery. The second exercise is going to be for the quad muscle. The quad muscle is on the front of the thigh. We want you to tighten this muscle, and I want you to push your knee down into the mattress, and then you're going to relax, and then you're going to tighten this muscle and relax. And again, each one you want to hold between 3 and 5 counts and relax. And let's do a few more together. And relax. And again. We want to ensure you don't have any increased joint pain when you do these. So if you need to modify the intensity, or you can only do 7 repetitions, that's appropriate until your joint has become used to doing these exercises. All right, you can go ahead and relax. The last one that we're going to do is called a heel slide. So if you're laying in bed, you may have to modify. You might need to take your sock off, or you might need a plastic bag under your heel. But what we're asking is that you bend this knee, drag your heel up closer to your body, pause when you feel a stretch, and then straighten back out. And then go ahead and bend, and then straighten back out. And repeat. So you want to go slow enough that you can acknowledge the stretch. but you want to move with a little bit of rhythm so that you can actually help loosen the joint up. Again, we don't want to have significant pain with this exercise. So if you need to only go part way, or you need to move a little slower, or do a few less repetitions, that would be appropriate. So one more time up, and then go ahead and come down and relax. So those 3 exercises are recommended prior to your total joint surgery. I'm going to show you a few pieces of equipment that we will be giving you while you are staying at OakLeaf Surgical Hospital to help with your safety at home. The first one is a long shoehorn that you will be able to use in sitting to help putting your shoes on and taking them off. The second is a sock aid, where you're able to place your sock on the bottom of the cuff, place it on the floor, and use the ropes to help assist getting your sock on. We will have time to show you this in detail during your physical therapy session. We recommend that you use it for calf height or shorter socks, typically not the TED hose or surgical socks. The third is a reacher and a grabber that you're able to use to make it easier while dressing or picking up items in the bathroom or the kitchen. And the fourth is a long-handled sponge to assist with lower extremity washing, reaching your back, and making it safer for you while in the shower. In addition to this kit of 4 items that we're going to be giving you to go home with, I want to bring your attention to the importance of putting rails by your steps that you plan to use on a regular basis, whether they're the ones going into the house, going to a basement, or an upper level, because you will find that to be more safe and secure than using crutches alone. Also, rails in the bathroom, grab rails, safety rails, extra places by the toilet to be able to assist with up and down may be beneficial for you.
Approximately 1 to 2 weeks before your surgery, you will begin receiving phone calls from a few different OakLeaf team members: chart prep, pharmacy, and case management. The calls may occur in any order before surgery and will allow staff to gather additional information that will help us plan for your stay. Now, members from each one of those teams will provide you with a little more insight.
I'm Katie, one of the chart prep nurses in the preoperative department. About 7 to 10 days before your surgery, you will receive a call from us to go over your surgery details and health history information. The call will take about 15 minutes. The business day before your surgery, you will get a phone call or a text message with your arrival time and eating and drinking instructions. Please make note of this information to better prepare yourself for the day of surgery. For any questions, give us a call Monday through Friday, 8 to 4:30.
Hello, my name is Wheeler, one of the pharmacists here at OakLeaf Surgical Hospital. There are 2 times you'll be talking to a pharmacist: prior to surgery and prior to discharge. Up to 2 weeks prior to your surgery, a pharmacist, myself, or one of my colleagues will give you a call to obtain a complete medication list. This list will include prescriptions, over-the-counter medications, herbal and/or dietary supplements. We will need to know the name, the strength, and how you take each medication. OakLeaf Surgical Hospital will provide or supply most of the medications needed while you are here, but occasionally the pharmacist will ask you to bring a specific medication to the hospital the day of surgery. If you are not asked to bring any medications with you, please leave all your medications at home. Any medications brought to the hospital, whether we are using it or not, will be given to the preoperative nurse and then given to the pharmacy to be stored in a secure location during your stay. Medications are not allowed at your bedside. That way we don't duplicate anything and don't give you anything that the doctors don't want you to take while here. After your medication list is complete, the pharmacist will review your list and inform you of what medications you should or shouldn't take prior to surgery. For any medications that you shouldn't take prior to surgery, the pharmacist will let you know when you need to stop taking them. Certain medications, the pharmacist may emphasize that you take the morning of surgery, as these may be beneficial for individuals that take them. There will be certain medications that we will ask you to discuss with your primary care provider. If you have any changes to your medication list prior to your visit, please give us a call at the number provided in the joint venture booklet. Prior to your surgery, I would ask that you consider what pharmacy you would want your medications filled at. This could be your normal pharmacy or a pharmacy closer to OakLeaf Surgical Hospital. Some things to consider with this decision are: what day are you going to be discharged? Will your pharmacy be open that day? And how late will the pharmacy be open? We also have an InstiMed dispenser located at OakLeaf Surgical Hospital, where most of your prescriptions can be sent to and then dispensed directly to you or a family member prior to discharge. If you have any questions about local pharmacies or the InstiMed dispenser, don't hesitate to ask the pharmacist on the preoperative phone call.
Hi, I'm Kayla. I'm one of the discharge planners that work in our case management department here at OakLeaf Surgical Hospital. Our overall goal is to assist you in returning home. One of our case manager discharge planners will call you about a week or so before your surgery to complete our case management assessment. This call will likely take between 5 and 10 minutes. During this call, we will discuss discharge plans consisting of discharge preferences, your home setup for your recovery, and medical equipment needs, for example, a front-wheeled walker, shower chair, and toilet riser. Case management will also discuss who your support person will be throughout your recovery at home and what location you would prefer to have for outpatient physical therapy. Since schedules fill up quickly, we encourage patients to call the therapy location of their choice ahead of time to set up their first post-operative physical therapy appointment, choosing a date about 3 to 5 days after surgery. Case management can be available to answer questions regarding advance directives. Advance directives are legal documents that communicate a patient's healthcare wishes. Examples include a living will and/or power of attorney for healthcare. These are explained in more detail in your booklet. We also have copies of advance directive paperwork for anyone interested. If you are not physically and/or medically able to return home, case management will assist you in choosing the best option for post-acute care. Some examples include skilled nursing facility, swing bed, or home health care. Transitioning to post-acute care will be based on skilled physical therapy needs, medical needs, insurance requirements and authorizations, and facility acceptance. One of our case manager discharge planners will plan to meet with you throughout your hospital stay. If you have any additional questions or concerns, case management can be reached Monday through Friday from 8 to 4:30. Please call one of the numbers listed in your booklet.
Hello, my name is Becky and I'm a patient financial specialist at OakLeaf Surgical Hospital. Prior to your surgery, our pre-registration department will verify your insurance and work with the schedulers at Chippewa Valley Orthopedic to make sure your surgery is approved by insurance. After your surgery, we will send a claim to your insurance on your behalf. This is for OakLeaf Surgical Hospital facility fees. The surgeon and the anesthesiologist will send in claims for their services. If there are any personal balances after payment by your insurance company, you will receive a statement in the mail. If you need to set up a payment plan, you can call us to work out an agreement. At any point during this process, if you have any questions, feel free to reach out to us. If you have any specific questions regarding your policy, I recommend calling your insurance company directly. I look forward to working with you and hope you have fast healing.
There are many things you can do before surgery to prepare your home. Consider the following suggestions to promote comfort and safety when you return home from your surgery. It is important to have a proper chair on the main level of your home. This chair should be firm yet comfortable and have arms. This will help when getting in and out of your chair. Also attempt to have your feet flat on the floor by using a cushion or footstool if needed. Your hips should be slightly higher than your knees, which is required for some hip replacement patients and a comfort measure for all patients. Take a walk through your house. Remove any obstacles you could trip over, such as throw rugs, cords, or other items on the floor. Make sure linens and clothes are kept clean. Meals are prepared and easy to reheat. Handrails are available on stairs, and that there is adequate lighting and paths of travel. It's also important to have any medical equipment you need available at home immediately upon discharge. Place frequently used items so they are easily accessible near the area you plan on spending most of your time recovering. For more suggestions on preparing your home, please review the Tips for Preparing Your Home section in the Joint Venture booklet. Keep in mind that it's valuable to arrange for someone to help you with medication, walking, physical therapy, meal preparation, and personal hygiene during the first 2 to 3 days after returning home. For the next 1 to 2 weeks after that, it would be helpful to have someone continue assisting you at least once a day. As you continue preparing for surgery, please notify your surgeon at Chippewa Valley Orthopedics if you have any of the following issues within 2 weeks prior to your surgery: any cuts, scrapes, rashes, sores, ingrown toenails, a new or recurrent infection, a dental emergency, metal allergy, immunizations, if your primary care provider has suggested you receive them, a recent fall, or any symptoms of a cold or flu, fever, sore throat, or recent antibiotic use. Any of these issues could affect your upcoming surgery, so it's very important to contact your surgeon at Chippewa Valley Orthopedics to make sure you can continue your journey. 2 days prior to your surgery, you'll be expected to start taking a shower using the pre-surgical soap kit that you'll receive prior to your procedure. This kit includes 3 sponges and 1 bottle of surgical soap. It also includes a piece of paper in there that will be attached, and it will have X's on the bottom on the days of the week you should start taking your shower. You'll be expected to take your first shower 2 days prior to surgery, your second shower the day before surgery, and your last shower the morning of surgery. The purpose of this wash is to help decrease infection after surgery. With that being said, it's also important to note that you should not shave your legs 1 week prior to surgery. Your pre-surgical soap kit has a total of 3 sponges and 1 bottle of surgical soap. With each shower, you are going to use a new sponge and a third of the surgical soap. Please follow these steps with taking your shower. Start by washing your hair with your regular shampoo and conditioner and rinse well. After that, please wash your face and genitals with your normal soap and water. Once that is finished, you're going to take your first sponge and the first third of the surgical soap and apply it to your body from the neck down, front and back, and let it sit on your skin for 60 seconds before you rinse off. Once you've rinsed off the soap, make sure to use a clean towel and put on clean clothes. Keep in mind that 1 week prior to surgery, you should not be shaving your legs, and once you start taking the showers, you should not be putting on any lotions, creams, or powders on any of the areas you applied the pre-surgical soap to. The soap is for external use only, so please make sure to keep it out of your eyes, ears, nose, and mouth. If you develop a rash, stop using the product and contact your surgeon. The day before surgery, you're going to be receiving a phone call or text from someone here at OakLeaf Surgical Hospital, telling you what time to arrive at the hospital for your surgery, and also what time to stop eating and drinking. If you have not heard from one of our OakLeaf team members by 2 p.m. the day before your surgery, call and inquire. If your surgery is on a Monday, you'll receive that call or text on Friday. You're also going to take your second pre-surgical shower on the day before surgery. Please do not use any lotions, creams, or powders to the areas you use the pre-surgical soap on, and remove any nail polish, nail lacquer, acrylic nails, false eyelashes, and any jewelry that you don't need during your stay here. Use the list included in your booklet regarding what to pack for your stay here to make it more comfortable for you. The list also reminds you to bring your advance directive if you have it available. On the day of surgery, you'll take your third and final shower. Please remember not to use any lotions, powders, creams, or apply any makeup that morning. Please brush your teeth. Do not eat or drink anything the morning of surgery beyond the times you were given by your preoperative chart prep nurse. This includes not having any chewing gum, mints, hard candy, or nicotine products. Doing so could ultimately delay your surgery or cause it to be canceled. If you have been instructed to take medications on the morning of surgery, it is okay to do so with a small sip of water. Please plan to arrive on time to OakLeaf Surgical Hospital. You will enter through door 3 as shown on the map in your booklet. You will check in at the front desk where staff will ask you to see your insurance card and photo ID. One of our staff members will verify your name, address, insurance information, and plan procedure. When the information has been gathered and is complete, you will be given a wristband and asked to take a seat in the lobby where you will eventually meet your preoperative nurse.
Hi, my name is Sean and I'm one of the pre-op nurses. I am here to share with you what you may experience while you're in our pre-op department. A pre-op nurse or a nursing assistant will escort you and, if you wish, a family member back to our pre-op department. We will ask that you get changed into a preoperative gown and we'll get you settled into bed. While you are here in pre-op, we will continually ask you your name, your date of birth, and ask you what you are having done. It is not because we are forgetful, but rather because we want to just make sure that we're keeping your safety in mind. In fact, expect many, many questions and a flurry of activities while you are in pre-op. Some of these things include checking your vital signs and blood sugar, and if necessary, drawing any labs or doing an EKG. We will review your health history, which includes the date and time that you took your last home medications, and we'll verify if you have any allergies. Your IV will be started, and you will receive any pre-op medications that your physician has ordered for you. Your operative site will be prepped with a surgical clip and a preliminary wash by your nurse or nursing assistant. A TED stocking or an SCD, a sequential compression device, will be applied to your non-operative leg to help with prevention of blood clots and circulation. Your surgeon will visit you while you're in the pre-op bay. They're going to validate what you're here to have worked on and mark their initials on your operative site and answer any last-minute questions that you may have. Also, you will meet your anesthesia team. You will sign any surgical and anesthesia consent forms, and we will review what to expect during and after surgery. Before you leave the pre-op department, you will have an opportunity to meet your operating room nurse, who will take you back to the OR and be in the room while you're in surgery. In the lobby, your family will be able to follow where you are at in the operative process by looking at the transfer board.
Hi, I'm Dr. Irwin. I'm one of the anesthesiologists with Chippewa Valley Anesthesia Associates that provides anesthesia services to OakLeaf Surgical Hospital. It is our goal to work with you after reviewing your personal medical history and your personal choices to come up with the best anesthetic for you. For your total joint surgeries, there are two options that you'll have. One, a general anesthetic, and two, a spinal anesthetic. And for some of you undergoing total knee replacement, your surgeon may recommend a nerve block, an adductor canal block for that. A general anesthetic is the anesthetic that most people think about when general anesthesia is thought about. For that surgery, you drift all the way off to sleep. You don't remember anything. You won't feel anything during surgery. What an anesthetic looks like is when it's time for you to come back, we'll bring you back into the operating room, help you move over to the other bed, and after hooking up our monitors, we'll have you breathe some oxygen through a mask. I'll then drift you all the way off to sleep with medications in your IV. Once you're deep off to sleep, we'll put a special breathing tube in the back of your throat. We are the experts in the hospital putting those tubes in. There's still, though, very small chance of hurting teeth, hurting gums, hurting soft tissues in the back of your throat. Most likely thing, a little pinched lip where that tube gets taped. You notice anything different in your mouth, though, afterwards, more than a pinched lip, we want you to let us know. You will also have a little bit of scratchiness in the back of your throat for about 1 to 2 days that we really can't do too much about. For that reason, we'll take it out at the very end of the surgery. We'll also be giving you some pain medications, anti-nausea medications during surgery. That being said, if you come out in the recovery room, if you're feeling pain, you're feeling sick, please let us know. The second option for anesthetic is a spinal anesthetic. The spinal anesthetic is a small shot that goes in your lower back that makes you numb from about here on down. It usually lasts for about 3 hours. To put a spinal in, we'll bring you back to the operating room, we'll help you onto the OR table and have you sit on the OR bed. After putting our monitors in, we'll give you some sedation through medication in your IV. We'll talk you through every part of it while we're placing the block. Anytime we poke it with a needle, though, there's always risks. Always a risk it'll hurt when it goes in. For that reason, we give you some sedation medication, and we also numb it up with a little poke and a burn, kind of a little bee sting. I've had patients that don't even remember us placing the spinal, but most people are very comfortable when the spinal goes in. Anytime I poke you with a needle, there's always risks of infection. For that reason, we wear sterile gloves. We prep your back sterilely widely. We drape it sterilely. We wear a hat and a mask. I've never personally had an infection doing these. Always a risk of hitting a vessel, causing bleeding, hitting a nerve and causing nerve damage. If those things were common, we would not be doing these. What is common is a block to last about 3 hours and then slowly fade off as we watch that in the recovery area. There is also a chance of, it's usually a less than 1 in 100, and a more recent study even showed it to be less than a 1 in 1,000 chance of a special kind of headache afterwards. If you get that special kind of headache, we take care of it, we make it better. About 95% of our patients are having a spinal anesthetic for their anesthesia. They've been very, very happy with their spinal anesthetic. One of our goals for you is to start rehabilitation as soon as possible after your anesthetic and recovery. With a spinal anesthetic, you're much less likely to feel sick to your stomach, more likely to be clear-headed, less likely to be confused, and most importantly, be able to start rehabilitation in a meaningful way as soon as possible. The Joint Commission also points to studies that are showing people with a spinal anesthetic request less pain medication over the first 24 hours than people that have had a general anesthetic. They also point to studies that show a decreased 30-day mortality rate and also a decreased length of stay in the hospital for people that have had a spinal anesthetic versus people that have had a general anesthetic. So for all these reasons, this is one of the reasons that we have a majority of our patients requesting a spinal anesthetic. Once that spinal anesthetic is in, we do help you get into a comfortable position for your surgery. And then once you're comfortable in the position that you are, we have you breathe some oxygen through a mask. There's no breathing tube. You'll be breathing through your own nose and mouth, and we give you sedation medications through your IV. I always tell people that you might remember little bits and pieces of surgery, sight, smell, or conversation, but a majority of our patients don't remember anything. You will be snoring and snoozing throughout the surgery and probably not remembering anything. But I always remind people, one of us is always with you right at the head of your bed, watching the monitors, watching your body language to make sure you are safe and comfortable. After surgery, we will bring you out to our recovery area just to make sure that the spinal is wearing off nicely and you're doing okay before we have you go on to the second stage of your recovery.
Hi, my name is Jenny. I'm a nurse in the operating room. Prior to going back for your surgery, a nurse like myself will meet you in the preoperative area and ask you some questions. Many of these questions you may have already answered, but we ask multiple times for verification and safety purposes. We will want to make sure that the correct operative site is marked with your surgeon's initials and that all of your questions have been answered. The operating room nurse will escort you back to the OR on a cart like this and will introduce you to your OR team. I like to let patients know that there are a lot of equipment and sometimes bright lights. There might be multiple people doing things all at once, but we'll try to explain everything to you, and if you have any questions, don't hesitate to ask. Your surgical team will be with you throughout the entire procedure to ensure your safety. Once the surgery is finished, the operating room nurse and anesthesia team will escort you to the recovery room.
Hi, I'm Nancy, one of the nurses in the recovery room. In the recovery room, you will be monitored by our highly skilled nurses, nursing assistants, anesthesia providers, and respiratory therapists. They will continue to care for you in this area until you've met our established criteria for transfer to the second floor. Usually it's about an hour, hour and a half. When you arrive to the recovery room, there's going to be a flurry of activity around you while we hook you up to our monitors and get report from the operating room. Depending on what type of anesthesia you had, you may wake up with an oxygen mask over your face or one of the nasal cannulas in your nose. As you become fully awake, you may notice some of these symptoms: blurred vision, dry mouth, nausea, chills, discomfort, and if you had spinal anesthesia, numbness to your lower body. Your care team will do everything they can to minimize these symptoms and to help alleviate any discomforts you may experience. In the recovery room, we will also obtain any x-rays if needed. The SCDs will be placed on your lower legs and the Iceman will be started. For the privacy of all our patients, friends and family are rarely allowed back into the recovery room. Our nursing staff will do their best to keep your friends and families updated. Usually staff will reach out to them after you've been with us about 30 minutes.
Hi, I'm Kim, a nurse on the second floor. Once you have met the criteria for leaving the recovery room, you will be escorted to your room where your family and friends can visit with you. Here you will continue recovery from anesthesia and begin your rehabilitation journey. As you continue to wake up from anesthesia, we will be monitoring your vitals frequently. For a brief time, you may be on oxygen therapy by nasal cannula or a mask. Exercises such as deep breathing and coughing will help eliminate your need for oxygen therapy. We will advance your diet as tolerated and we will encourage you to sit in your chair for all meals. Our goal is to begin your rehabilitation journey by getting you up and walking within a few hours of arriving to our floor. It's not uncommon for your legs to feel heavy. You may be lightheaded or dizzy. For that reason, we will have 2 nurses safely get you up for your first walk. After your first walk, we will remove the Foley catheter if you have one in place. We encourage you to walk frequently in the hallway with the assistance of staff. A blood clot preventative measure will be initiated during your stay, and you will receive instructions for continuing the regimen when you go home. Some of these measures include ankle pumps as instructed by staff. Compression stockings similar to these will be applied. You can take them off at night and back on in the morning to wear them during the day. An anticoagulant or blood thinning medication will be prescribed, such as aspirin, Coumadin, Xarelto, or Eliquis, just to name a few. While you are in the hospital only and in bed, SCDs, also known as sequential compression devices, will be applied to your calves. These inflate with air and then deflate, promoting circulation through your legs. A common concern after surgery is constipation. Medications we give you during surgery and medications you take during your rehabilitation can be constipating. For that reason, we will start you on a medication to counteract those effects. We encourage you to drink plenty of fluids and increase fiber in your diet.
Hi, I'm Joyce, a nurse here at OakLeaf Surgical Hospital on the 2nd floor. As you continue your recovery on the 2nd floor, your IV will stay in place so that you may receive pain medications, antibiotics, and fluids that will help hydrate you, as this will help to prevent any post-operative complications such as low blood pressure or a slow heart rate. Once all IV medications ordered by your provider are completed and you're well hydrated, the IV will be removed. Depending on your provider, you may or may not need to have labs drawn after surgery. This will be based on the type of surgery you had, your health history, and any other factors that would suggest lab work is necessary. Similarly, your surgeon will determine whether or not you would benefit from having a drain placed near your surgical site for a short time during your recovery period. This drain will extract any excess fluids that are next to your surgery site, which will help you heal. If you notice a drain in place when you wake up from surgery, know that staff will offer education and remove it before you leave the facility. One thing that most patients can expect to have following surgery is pain. Know that pain is a normal part of the healing process. Staff will ask multiple questions about the pain that you are experiencing, such as where it is and what it feels like. They will also ask you to rate your pain using a number scale from 0 to 10. Gathering this information helps us identify the intensity of your pain and decide what may work best to alleviate your discomfort. Together, we will come up with a plan to reduce your pain to a more tolerable level, using one or more of the following methods: repositioning, movement, elevation, distraction, medications that are ordered by your provider, and cold therapy such as an Iceman. This is the Iceman. It is a cooling device that you'll be going home with when you leave the hospital. It circulates cold water that's put on your surgical site. Usually it is put on in the recovery area, and it'll be used frequently throughout your stay here at the hospital. I will show you how to take care of it when you're at home and how to use it when you're home. So first you would take the cover off the Iceman. In the Iceman there's a line. You could use ice cubes, you can freeze ice cubes ahead of time, so you can buy bags of ice cubes, or you can use various containers to put water in and freeze, and then simply pop them out into the container up to that line. Once you have the ice in the Iceman, then you can go ahead and add water up to that same fill line. When that's done, go ahead and put the cover back on the Iceman and take the hose that's attached to the Iceman and the choline pad hose and put them together, snap them until you hear them click, and you want to make sure that they're nice, snug, and secure. Then you can take the power source and plug it in to the back of the Iceman. And after you have it plugged in, you would take the power cord end and plug that into the outlet or your power source. Once it's plugged in, that will turn the machine on. It'll make a little bit of noise and it might hum a little bit as the water is going through the tube and into the cooling pad. You would always want something between your skin and the cold therapy, whether that be a pillowcase or a towel, just something between your skin and the cold therapy. You would then place the cold pack on your surgical site. The way that you know that you need to change the water or add ice or change the ice out is that the cooling pad simply won't be cold anymore. The Iceman does not have an on-off switch. The way to shut it off is simply to unplug it from the wall outlet.
We are going to teach you how to use this walker so that you are safe when you go home. So your best option is going to be to scoot forward a little bit in the chair. Keep that sore leg out in front of you just a little bit, and you maybe can choose how far it is out there. It doesn't need to be further than you need it for comfort. Once you have that spot figured out, I want you to put one hand up on the walker, and you're going to push really hard from that hand, and I want you to stand up, and then I want you to pull that left leg back underneath you and just get your weight through that knee. Once you feel situated, the process is going to be moving the walker forward, then your surgical leg, and then your good leg. And your walker, and your surgical, and your good leg. And if you can get into kind of a cruise where you're just taking one step in front of the other, and you feel safe with that, that's appropriate. If you need to stop and take shorter steps, that's okay as well. There you go. We are going to teach you how to walk with crutches. So crutches work well in smaller spaces, bathrooms, kitchens, or sometimes just as you progress through your healing, crutches can be a good option. So in order to stand up from the chair, I want you to put one hand on the crutches, and then you're going to put one hand on the chair. You're going to go ahead and stand up. You're going to move one crutch to the other side. So take that outside crutch, move that to the other side and get it situated under your arm. And then we're going to do the same with this one. And then just kind of get your bearings there. Pull that leg back underneath you a little bit. There you go. Then the process is going to be very similar to using the walker. You're going to move the crutches forward, then the surgical leg, and then the good leg. And the crutches and the surgical leg and the good leg. And repeat that process. And one more step. There you go. Very good. We're going to teach you how to do the steps to get into your home or anywhere inside your home with these two crutches. So once you are close enough to the step, I want you to go up with your good leg, up with your surgical leg, and then the two crutches come up. And then your good leg and your surgical leg, and bring your crutches up. Then come across this platform and we'll talk about how to go down them. So to go down, you're going to put your crutches down, put your surgical leg down, and then your good leg, crutches, surgical, and then good. And then one more time to the ground, crutches, surgical leg, and good. There you go. Nice job. We are going to talk about how to go up the steps that you need to do to get into your home or anywhere inside of your home. So if you have a cane, you can use a cane opposite a railing to be able to assist with that. Now, it doesn't matter what side the cane goes on right now, it just goes opposite the railing. It will matter down the road where the cane goes when you're walking, but for right now, for your safety, you hang on to the railing you have and then you use a cane in the opposite hand. So we're gonna put the cane down alongside of you. You're gonna put some weight through the railing, some weight through the cane, and you're gonna go up with your good leg. Yep, and then push to bring your surgical, and then the cane comes to meet. Up with the good, and then the cane comes to meet. Now just step across this platform. So coming down, you want to put a fair amount of weight through that sturdy railing. You want to put the cane down, surgical leg comes down, and then your good leg. Bring your arm down the railing, cane, surgical, good, and then one more step, cane, surgical, good leg. Then here you could have your walker or your crutches waiting for you to continue onward in your home. So I want to take a moment here and teach you how to get in and out of a vehicle to be able to go home. It's going to make the most sense for you to ride in the front seat passenger side. You'll find that you have more pieces within the car to be able to move and shift. So I'm going to demonstrate what it may look like to sit here and get into a car. So as you approach with your walker, you're going to get as close as you can to the car seat, keeping your walker with you the entire time. We encourage you just to sit on the edge of the seat. Someone can move your walker out of the way for you. And as you scoot into the car, you may need to use the roof or the edge of the door or the dash to be able to scoot in far enough that then your legs can clear the dash as you slide into your seat. Once you're there, you can adjust your seat forward or maybe slightly back to be able to find a comfortable position for your leg to rest in. Some people find that additional pillows for behind their back or a plastic bag on the seat to be able to spin with can make it easier getting in and out of the car. So to get out of the car, you would repeat the process in reverse. You may need to slide your seat back, and you're going to start by scooting and turning, typically using your better leg and your arms, as well as items like the hook in your car, the dash, or the door, and then scoot forward, and someone can help by bringing your walker to you, and then you're able to stand and move forward.
Hi, I'm Debbie, a nurse on the second floor. I'm going to talk about the discharge process. The majority of our patients discharge the morning following surgery. However, sometimes it is earlier or later, depending on individual circumstances. The decision for your discharge will be made collectively with your care team. There are a few steps to complete and certain items to consider in order to safely discharge. Your surgeon or their assistant will check in on you, see how you are doing, answer any questions that you may have, and write discharge orders. Physical therapy will evaluate and instruct you to determine when you can safely discharge. Family and caregivers are invited to attend this session. It can be very helpful to listen and watch the therapist work with the patient. This is not required, but highly encouraged. You will be given instructions on how to care for your incision and do dressing changes per your doctor's instruction. Any needed supplies will be sent home with you. All scheduled antibiotics will be completed and ordered medications given. And lastly, we will ensure that any pain or nausea that you may be experiencing is manageable. Once these steps are completed, your nurse will print out your discharge instructions and review them with you. These consist of appointments with your doctor and physical therapist, your doctor's discharge instruction sheet, helpful tips for managing at home, and medication lists.
The other time you talk to a pharmacist is prior to discharge. At this point, you're planning on going home, and the doctors will prescribe new medications for you. They will review your home medication list to determine which medications you can continue to take and which medications need to be held or stopped for a short time period after surgery. A pharmacist will review your home medication list and go over any newly prescribed medications with you. Some examples of new medications at discharge are pain medications, antibiotics, medications for constipation, anti-nausea medications, and anticoagulants, which will help reduce your risk of developing a blood clot after surgery. Please follow the instructions and documents at discharge regarding your medication plan. If you have any questions about your medications prior to surgery or after discharge, please give us a call with the numbers provided to you in the joint venture booklet.
Once everyone is finished meeting with you to discuss your discharge information, you are ready to go. Our staff will help gather your belongings and assist you to door number 4, where your driver can pick you up. Please refer to your discharge folder and joint venture booklet after leaving the facility, and feel free to call us if you have any further questions or concerns.
Thank you for taking the time to invest in yourself by joining us along this important journey. We wish you a speedy recovery and hope that you return to the life you desire with your new joint in place.